Just visit the new CalgaryHerald.com with more of everything worth knowing.
There's a lot of mistrust of what we're on about. There's nothing I can do about mistrust except to say wait and see. So you can see that the environment is one where they'd be I can understand why they are mistrustful. And of course they haven't seen me deliver. You know, Garrison Green won't open until April or so of next year. And so when I promise that Garrison Green will open, they say, we've heard that before for the last 5 years. And so all I can do is sit here and wait and say, OK, we'll wait until April, and then you'll know whether I deliver on my promises or not. In Alberta, alternate level of care. In Australia, they're called nursing home type. You know, I'm ascribed all sorts of views about what my views are and what my creeping agenda is and so on, which, when I look at it, I think these people have no idea what my views are on any of these things. And then they're saying, you know, I'm trying to introduce a US-style health system in Canada and all sorts of things, and just making it up. Now, it might be because of the environment in which I've come. That is, I think the Klein government had an agenda X years ago, which people portrayed as being about creeping privatisation of the, you know, etc. And so they think that so they're wary, I guess, and so that I think that might be that I'm being ascribed views that I actually don't have, and they're anxious about that. I think if I look at the Calgary and the Edmonton strategies, I think we're actually improving the quality of care at the same time as saving money. Because what we've targeted there was people who are in hospital who don't need to be in hospital and whose hospital beds are really not the right place for them personally. So getting them into the right place is actually improving their quality of life. So it's improving their quality of life and at the same time saving money. So part of our job as health administrators, as a health leader, is to actually think about how can we balance those three objectives of access, quality and sustainability. And that's what our job is.